find the tibial condyle, come a little bit anterior to that because I know I'm between the femur and tibia. That's easy to find in the front, and then just work my way around to the back. Okay. Use your fingertips. Your thumb is a little too big to fit in there. The joint line's, maybe a few millimeters. It's not very big. All right. But I need to push hard enough so I feel like I'm in that little tiny groove between the two bones. And then I do the same thing on the left. Sure. All right, so I think the easiest way is landmark the tibial condyle in the front. Come superior to that. I can feel that gap between the femur and tibia pretty easy in the front. Then it's going to get a lot smaller. It's going to start like this, and it's going to get a lot smaller as I work my way around. But if I find it from the front, it's easier. Because if I start back here, it's going to be a little bit more.
And then the last one's just
McMurray's test. Ideally, I have my fingertips and thumb on the joint line. This will help me control the femur. Start in full knee flexion. Externally rotate or internally rotate, doesn't matter. And then come out into extension.
I straighten that elbow out and I use
reverse it, internally rotate, and then come out into extension. Make sure you go into full knee flexion if they can do it, okay? Because that's generally where you're going to find it. And sometimes you can just come here and scour it back and forth, and that's all you really need to do to find it. Okay. Most often you're going to have joint line pain with that. The clicking is going to be much less common. If you feel clicking, it's probably not from the meniscus. It's probably more from the patellofemoral joint, maybe the IT band, maybe even up at the hip. Those are all much more common. Okay, like on Emily, I could feel it, like a little crepitus. That's normal. Okay, but if I feel like a deep clunk and I feel it distinctly at the joint line, that would be positive.
I see how it is.
That's another just little aside. A lot of patients will have clicking in their knees, crepitus. When is it relevant versus I can just tell the patient, don't worry about it. Pain involved is generally when I'd say, okay, that could be relevant. How about knee OA? What is our knee OA cluster? What does that mean? Remember? Crepitus, morning stiffness, age 38 or older, and then possibly bony enlargement, where I'm going to see maybe enlargement of like the femur or tibial condyles. But a lot of you guys probably have clicking